what was your first experience with the chemical culture of bodybuilding?
Well, when I did my first show, when I was 14 in 1985, I was natural, obviously, if you didn't know that. But I knew about steroids. And after I got my first place trophy there, I'm the type of person where, hey, if I'm going to do this, I'm going to do this all the way. So I wanted to find out what's the next show, what's the pinnacle, what's the ultimate, Mr. Olympia's the top thing. So I mean, I read magazines and I talked to people in the gym. I knew about steroids. So I already had a game plan in my head almost at the age of 14 of when's the right time to start this. You know, when, you know, I kind of knew at the age of 14, 15 that was too early. And in my mind, I kind of came to the age of, I thought, okay, once I turn 18, you know, maybe I'm an adult, then I would start my first cycle then. And I did that. So I competed at 15, 16, 17 naturally. And then I did my first cycle on my 18th birthday is when I first took my first bodybuilding drug. I took D-ball. I went up to, there were 5 little blue pills, 5 milligrams each. I took 5 a day. And actually the gains weren't for training and competing for 4 years. And then, you know, just, you know, because people would come up to me all the time when I was 16 years old, older guys that were competed that I looked up to, would be like, hey, Mike, what are you taking, dude? And I'd be like, I'd feel good because I was like, nothing. Wow, this guy thinks I'm on something. And they'd be getting pissed, like, no, what are you taking, dude? I know you're doing something. And I'm like, I'm not, you know? So in the back of my mind, I'm thinking like, man, wait till I take something and I blow up and I'm going to blow these people's minds. And when I took it, you know, I might have gained 8 or 10 pounds, but not the amazing gains that some people think it is, you know, 20 pounds on your first cycle. I mean, I made some good gains, but it wasn't anything that was out of this world.
When would you say the real gains came? Early, the first real early gains, not before you step things up, but like your first proper cycle.
I'd say it's a natural progression, you know? Everything has to be in place. Your mental attitude has to be in place, your diet has to be in place, your training has to be in place, your drugs has to be in place. I started small and just consistently, every time I did a cycle, I mapped everything out, I wrote everything down, I had diaries of everything, and then each time I would do I would always make sure I did an off cycle. You know, the amount of time that I was on, I did at least that amount of time off. I think the first time I did an 8-week cycle, and I think I took 16 or 20 weeks off. And then my next cycle, instead of doing 8 weeks, I did 10 weeks. And then the next cycle after that, I think I added an injectable. I added maybe Deca or something like that. So just throughout the years, it just naturally progressed on to the next thing. Just like when I was 15, I was probably inclining the 45-pound dumbbells, and then I'd work my way up to the 55s and the 65s and the 75s into my pro career when I'm pressing the 200s like Ronnie. So a whole natural progression. Bodybuilding, you know, I built it.
What would you say when you transitioned from the winning North Americans to going to the pros? Did that natural progression just continue, or did you step it up at that point, or did anything change at that point really, or just keep doing what you're doing?
It was just a vindication. Turning pro is you got your card and you made it, you know, and I didn't do anything outside of the box. I didn't step it up any more than I normally did. I just figured, hey, I got a winning package here and a winning formula. I'll just continue to keep doing what I'm doing, and so that's it.
And so how would you say your cycles changed in the course? Because you started competing early. You've been competing a long time.
Yeah.
How would you say your competitive cycles from when you first started doing really well at shows to turning pro? How would that progress in that time? Because you were at the national level a while.
Yeah, 1990 was my first national show.
Exactly. You know, did you just start upping the dosages then, or just that natural progression?
Yeah, like I said, each time I did a cycle, I would just, I would never do the same cycle twice, you know? And if I did, it would be more of what I took last time. So yeah, just a natural progression.
And then as your cycle started to advance, what became, and I read a little bit about this, how your off season would become a little bit shorter, but what's your type of theories of off season, cycling off, and would you consider coming to TRT doses or HRT doses, or coming off completely? And also, of pro guys, how many of them are like, what do you think is the common practice? And I know there's a spectrum there.
Right.
You know, there's a huge spectrum. But what, you know?
Well, I like to say, I can only speak for myself. You know, I've spoken to a few other pro bodybuilders and asked them about their cycles, but even a lot of times when you ask them to their face, you don't know exactly how honestly truthful they're being. You know, I've worked with a lot of natural competitors that, you know, say they're natural, but I know for a fact that they've done stuff in the off season, or if they get it prescribed by a doctor, they think, oh, I'm natural, but you're not. You know, it's kind of like you're lying. But like I said, when I would do a cycle in the earlier days, if I did an 8 or 10 week cycle, I would want to take 8 or 10 weeks off. I always did an off cycle. Even towards my pro career, even if I was doing a 16-week cycle, I would take an off cycle. Now I might take, after that 16-week cycle, I might do 2 weeks of HCG and then a week of Clomid, and then maybe take 2 or 3 weeks off until once I noticed my strength gains or my strength was going down, and then I'd go back on, which would maybe be 4 or 5 weeks off, something like that. So it's not much off time, especially towards the end of the career.
And what would you say, at what point did you start to implement stuff like growth hormone and insulin? When did you start to hear about those things in comparison to anabolics? Because I feel like a lot of people know about anabolics before the other stuff.
Right.
And when did you start to implement those stuff? Even if you did insulin or GH at different times, like at what point in the career did you feel that it was appropriate to do those things?
Well, I remember, I think I did growth around 1994, which coincidentally, 1994 was the first year I placed at a junior national show. So did growth hormone have something to do with that? Maybe, you know, could be. And then a few years after that, insulin came along, and I was doing insulin for years before I turned pro in '99, and that's a very powerful drug, insulin. But it's also a drug that can kill you, you know, and I have a few stories about that too. So.
Well, I'm kind of interested about those. What type of stories do you have about that?
Well, there was one time I would take insulin in the off season, and I'd take it with growth and with the anabolics, and it's a great drug for size and to shuttle, you know, aminos and glucose into your muscle cell, and it's definitely good for size and for your pump. Off season, great. Pre-contest, it's kind of tricky, you know, because you're cutting your calories down, you're not taking as many carbs, and I think it was 2 years, maybe the year before I turned pro, and I'd take too much insulin, and I had like an episode at my house. Thank God I had a girlfriend that was there with me that actually ended up calling like the 911 or the fire department and EMS, and police showed up at my door. I was fishing out on the ground. I remember, because insulin, your blood sugar gets so low on insulin that you could literally fall on the ground face down, wake up looking at the ground, and then, you know, think to myself, okay, I need to get up and I need to get some carbohydrates, some sugar into my system. I'd have my oatmeal sitting on my table, and then as soon as I stood up, the amount of sugar it took to get me off the ground, I'd fall right back down again. So like I said, thank God I had a girlfriend that was there, because I was throwing dishes around and getting like erratic and stuff. And then the EMS came and the police came, and it was a bad scene, you know, because if she wasn't there, if I would have hit the deck and not got up, I mean, I could have went into a coma or possibly died.
That's how did you? So you were using insulin as an amateur getting into the national race.
Yes. Yep.
And you started that after you'd already made the top 5. What? This is actually a question from a guy who's probably about to turn pro next year. His question was like, what effects have you seen insulin take on a physique? Like, how effective is it? And do you think there's a difference from person to person also? And have you seen negative effects of insulin as well?
Yeah. Insulin's a great drug for putting on size and for strength and for your pump. But it's dangerous. It can kill you, you know? You have to use, and I was always smart enough to start with a very small dose, small enough that I didn't even notice the effect. And then
it's around 97.
Right. And then I would build it up to a point where I could actually feel the effects. But you have to, you know, it's a dangerous drug. You have to be careful. And if you take too much, you can damage yourself. You know, you can mess up your blood sugar for life.
Did you prefer short acting or long acting?
I usually took just the R. just the regular, just the R. I had the Humalog and I might have used that before, but that's even faster and even harder to control. You can take that, and if you don't have, if you don't put any carbohydrates in your system, it's going to burn up whatever's in your bloodstream, and you're gonna pass out. So
what type of units would you say you were using of the insulin?
I think
towards the end. How about that?
Towards the end, the most I've taken was probably about 10 or 12, about 3 times a day. And then, there's the old theory about a gram or 10 grams of carbs per unit. So if I was taking in 10 units 3 times a day, per that 10 units, I would make sure that I had at least 100 grams of carbs. I would take my shot, and then within like an hour to 2 hours, I'd take in at least another 100 grams of carbs after that, if not more. Off season, I would just try to shovel in as much as I possibly could. I wouldn't even count, So.
And so you just go all the time.
Yeah.
And so what about with the growth hormone? What would those levels get up to eventually? Also here, let's start off with another question. What did you think of the impacts of like generic growth hormone versus like legitimate growth hormone? And would you say it's really like a prescription is that much better than say like top?
Well, let me back up Let me back up to '94 when I first took it. Back then, the only growth that I could really find was Humatrope, and that was made by Lilly, and that was an actual American pharmaceutical growth hormone. So, and they did fake that, but I mean, if you got a good eye, you can tell, between a real label and the boxing and the inserts that comes with growth. So, I mean, I only got real growth. I think I had a good enough eye to spot the bad stuff. The doses I started with were probably about 2 to 4 I use every day, maybe about 4 days on, 1 day off. But growth hormone, there's another amazing drug. A lot of people take that now for, kind of like the fountain of youth kind of thing. Steroids will make your muscles grow and get stronger, but they won't make your ligaments or your tendons grow. So there's a danger there that you're going to injure yourself. Growth hormone makes everything grow except for your brain and your eyeballs, I heard. So it's an amazing drug as far as transforming your body. Steroids cause hypertrophy, which means the muscle cell grows bigger. Human growth hormone causes hyperplasmia, which means the muscle cell divides and you actually have more muscle cells to grow and get bigger. So you can actually get bigger on growth than you possibly ever could on all the steroids you could ever possibly take. So that's kind of an exciting aspect of it.
How much of an impact did you notice from the growth hormone at first and long term?
At first, it's really, you read so much stuff about you're going to gain all this weight, but the main thing you notice is you get more muscular. Your body fat comes down, you can eat a tremendous amount of food, and your body fat will still go down. It kind of turns you back into being an 18-year-old kid, where you can just eat pizza and cheeseburgers and candy and gallons of ice cream, and you still have a six-pack and veins.
You're telling me IFBB pros eat cheeseburgers and candy? And
yes.
So let's talk a little bit about that.
Yeah.
So what, like the off-season eating, what percentage would you say was standard clean eating? And how much was just getting like McDonald's, Dave Plummer was eating McDonald's burger a day.
Right, and I subscribe to that technique every once in a while. I mean, especially when I was on growth hormone, I would go to McDonald's, I'd probably get about 12 hamburgers and put 3 burgers on 1 bun, and then eat, 4 of the triples, and I do that a couple times a week. And on growth hormone, you can still, stay shredded on that. I wouldn't do it every day, but once a week. But yeah, growth hormone allows you to keep your body fat down and still eat a tremendous amount of food, and even shit food.
So when would you say, like on the internet, a lot of people like know about your health problems, stuff like that. When would you say you first got, like, what was the first thing that you're like, oh, I might have issues?
Probably every time I went to the doctor. Every time I went to the doctor and they took my blood pressure and it was 200 over 110, and depending on the doctor, they were like, you need to stop this or you're going to die, or basically that's all they said. You need to stop, or you're going to kill yourself.
And at what point in your career did that message start getting relayed to you? What would you say? How long did you keep going after it?
5 or 6 years,
So around pro card time?
Yeah, basically, and then soon after, and then as a pro, I was living in California. There was a friend of mine who was a chiropractor, and I went to get my blood work done, and I was just waiting to get the results back because at this time I could read blood work myself. And luckily my friend was like, Mike, you need to go actually talk to this doctor because he needs to talk to you. So I went to him, and he actually referred me to a nephrologist, which is a kidney specialist. And when I went to the nephrologist, he basically was a straight shooter and just said, hey, Mike, you know, where you're at right now with your tests and all, we just might have to get you set up for dialysis in the next year or so. And then when I heard that, it was kind of like God was giving me a little tap on the shoulder that was saying, hey, you know, you got a path to choose, you know, and it was either continue bodybuilding and the dream you've had your whole life, or let it all go and live. So I chose to live.
And a few people have died since that period.
Yeah,
you know?
yeah.
And so, what would you say, like, the biggest, like, health factor, like, because you know your blood pressure got really high, but would you say the excessive eating, the drugs, certain types of drugs, like, what would be the most strenuous thing on a bodybuilder, would you say?
Painkillers.
And that was rep drugs, but here, let's start off with painkillers. Go for it.
Yeah, because I mean, I was taking steroids for years, and then it seemed that once painkillers and Nubain kind of came onto the scene, it's a sneaky bad drug, you know, because you take them for some injury, and then you come off of them, and then another injury comes along, and then all of a sudden, as a bodybuilder, you're taking such an arsenal of drugs and injections. You know, what's this little Nubain shot that I'm taking, or this Vicodin I'm taking here and there? But you know, it's a narcotic, and it digs its hooks into you. And when I retired and I stopped I said, okay, I'm going to stop all these drugs. Once I got my mindset, everything was fairly easy to let go. But it's the painkillers and the opiates that kept coming back, and it's a issue I deal with to this day, you know? So, and I feel like that was the hardest thing that put me over the edge as far as my health problems. I think if I just did straight bodybuilding drugs, I probably could have squeaked out a few more years.
I want to like highlight that video for people to know. You know, that's a great point. And so you'd say the biggest thing was the painkillers that we got. And so
terrible for your liver and your kidneys. Terrible. And the acetaminophen is in them, because you know you're taking Vicodin or Percocet that has 500 milligrams of acetaminophen in them. You're taking 10 of those at a time. I mean, that's enough acetaminophen to.
You throw that in with everything else you're doing, it's not a healthy combination. And what would you say, at what point, how about the Nubain? When did you, well, how about first painkillers, like at what point did
It was Nubain. It was Nubain.
Okay.
It just came, I think I was friends with a pharmacist that just wanted to sell them to me, and I was like, no, and then came back 2 months later and ended up just giving them to me. And I didn't even want to take them. And then I tried to sell them to somebody and tried to give them away, and I think I actually gave it to somebody, and I think they actually gave it back. You know, and you read about articles and stuff, and then I think one time I took it when I got home, and I took a very small dose. I took it sub-Q, just a little bit, and enough to where I didn't even feel it, you know? And then I wouldn't take it for a while, and then maybe a couple weeks later I took just a little more, and then I felt a little bit of it, like you had a glass of wine or something. And I remember I would write it down on my calendar, you know? And then I'd see like I went 2 months without taking it, but then once you get it in your system, you know, that's when your body starts craving it. And then once every 2 months became, you know, once a month, and then became once every 2 weeks, and then became once a week, and then became just on the weekend, and then became, you know, until it became every day, and then it became...
At what point would your career, did it start, and at what point would you say it became an issue?
That's a good question. I remember when I moved, I was already taking Nubain before I moved to Venice Beach, which was 2002. I was already taking it. When I moved to California, I started shooting it intravenously. That became a problem, because once you start putting stuff in your vein, then it's much more fast acting. And yeah, probably as soon as I moved to California. It's such a drug culture out there, you know, which is probably why I started shooting it up. You're around so many people that are doing it too. They're like, why are you taking it this way? Take it that way. And yeah, so
would you say
California's a bad influence.
Yeah. Would you say painkillers are like the biggest rec drug? What other rec drugs are big? Like
ecstasy, cocaine, meth. I was smart enough to stay away from a lot of those, you know. Ecstasy's fun with the right people in the right place, but
there's a time and place for everything.
Yeah, but yeah, cocaine and meth, I mean, of course I've tried them before, but I mean, they are bad news, you know. I mean, I knew some bodybuilders that would take meth or coke to cut up for a show, and that's just burning your candle at both ends and ridiculous to me.
What do you think about the cocaine diet? How about that? Since I don't hear about the cocaine.
I've never heard of the cocaine diet.
Well, no, I'm asking you, since you're telling us that people would use it to get cut up for shows. They would use it to like.
When I heard that, I was just like, that's ridiculous. That's like, I mean, why? I don't know. It's just, why would you take a street drug to, you know, it's the wrong way to lose body fat. It's the wrong way to give yourself energy and lose body fat. It's not a bodybuilding drug. That's a club drug, you know? That's two separate things, you know?
At what, how many other bodybuilders during that period did you know that had problems with Nubain as well?
A handful. There's always a handful. There's always a small percentage at every gym that people are taking it, especially back in the East Coast. Yeah.
The East Coast as
well, in California too, you know.
And DMP, what was your, I know you told, well here, I'll let you explain it.
Right.
What was your experiences with DMP and what have you, like, what types of things you've heard about?
Well, like I said, growing up in New Jersey, I mean, I know there's a few guys up in New York that took it and died. So, I mean, I heard of that story and I just kind of discredited it right there and decided never to take it again. And I really didn't hear of too many people that have taken it. As a matter of fact, I might have heard of one person that's taken it before. So I've just stayed away from that drug. You know, if there's a drug where the side effect is kill you instantly, I, you know, try to shy away from it.
If you could give a piece of advice to prolong the career of a bodybuilder, in retrospect, 2020, you know, what advice would you give?
Stay away from painkillers. Control your blood pressure, because there's drugs out there you can take that can control your blood pressure that won't interfere with your training, your diet. You know, every time I saw a doctor, they're like, you need to stop or you're going to kill yourself. You know, if I had a doctor that said, hey, I know you have a goal, control your blood pressure, you know, you'll be healthier and you'll be a better competitor, you know. If someone said that to me, I would really take that information in. So if there's something I can tell people, you know, especially bodybuilders, a lot of things they take and they do, it's making their blood pressure high, and that's eating away at their heart, it's eating away at their kidney, and it's just bad for you all around. So control your blood pressure. There's natural supplements you can take, and there's actually medication you can take that will control your blood pressure that won't affect, you know, your lifts or your training or your contest prep. And that's when I went to the nephrologist, and they were, you know, I was faced with the decision of, you know, hey, the best you've ever done in your pro career now, and you got to let it go. So.
And how did the downsize process begin? Like what, you know, like what, I mean, after your because you competed again, but then after that, what was your goal, you know?
Well, like I said, when I was in the office of the nephrologist and he said, we got to get you set up for dialysis, you know, first thing I said to him was like, okay, what do I need to do? What do you need to prescribe me, and what do I got to do to make myself better? What do I have to do to heal myself? I'm ready to do this. And he said, there's basically nothing you can do. Your kidneys don't heal themselves, and it basically just gets worse from here. And, you know, I did whatever I do to every doctor and said, I'm not going to listen to you. I'm just going to do my own thing. And I stopped, and I was like, well, I just use common sense. I said, the first thing I need to do is stop taking all the drugs I'm taking, which means every bodybuilding drug, every painkiller. I need to stop all the drugs. I need to research this and find out what I need to do as far as lifestyle changes, lower my protein, control my blood pressure, find out whatever holistic medicine is out there, things I can do and things I need to take to heal myself. And I did that. And thank God, you know, my kidney levels came back to a normal level. But I took all the dedication and perseverance I had that I put into becoming a pro, and now I put that into saving my life. So,
which is more of an accomplishment. If you
yeah,
right?
Well, I went back to the nephrologist 6 months later, and I remember him looking at my blood work test again, kind of laughing in a sense, saying like, wow, this is impressive, Mike. I didn't expect to see this. And that kind of gave me hope that I can continue to get myself better, and I did.
Escalin, or is that how you say it?
Aceclidine?
Aceclidine. I'll go with you on that one.
Yeah.
Thoughts, opinions. That's something people don't talk about a lot.
Yeah.
How much in the 90s would you say guys were using it pre-contest?
Anybody that could get their hands on it. I know I always tried to get my hands on it. If anybody had it, I was like, I'll take it. It was a neat drug. It's not like Synthroid. It's not just oil. It was an actual drug. I think it was made in Italy. And it came in little ampules, little 2 cc or 1.5 cc ampules. And you'd inject it directly into your muscle, and it would inflame your muscle. I don't know exactly what it was used for. I think I heard somewhere that since it inflames the muscle tissue, they could do something where they could go in there to perform surgery on muscles or something. But it did inflate your muscles, and you could use it on your side delts and your biceps and your triceps or lats or wherever. and it worked, and it worked good, but it only worked for about a day or so. So you had to use it the day of the competition. So you basically would buy it and stock up for it, and then the day of the competition, and you
think it had that big of an impact?
Not really, because sometimes you'd put it in your bicep, and your bicep is long, and sometimes it would almost look like they inserted a hot dog underneath your skin. So this side, the middle of it, would be pumped up real big, and the other side wouldn't. But then people would say, "Well, just put a shot there," And like I said, the same with Synthroid. Sometimes people's bodies would take it, and it would look good, and it would make it look bigger, but it would also make it look a little smoother or kind of waterier. It wouldn't have that crisp, hard condition, But if you have weak biceps, it would definitely put biceps on you. But I mean, I haven't heard of too many guys that would lose shows because their biceps weren't up to par,
That's interesting. When did you start to use that? Or what shows? What era?
I'm trying to remember. It was probably post 91. I don't think I had it at the Teen Nationals. I don't think I had it at that point. Probably early 90s. Yeah.
And then back to like the rec drug stuff. So like you mentioned like the painkillers are still an issue. Like they can still be issues. Like and it's been how long since you competed? Like
2005.
2005. So a couple years.
Yeah.
How big of an issue is that still? Would you say?
It's hard. It's hard. Like even if I go to a dentist, I mean, I had to get a tooth pulled a couple years ago, and I was freaking out. Like, he's going to give me something. Do I take it? Do I not take it? And it was like, I thought I was going to have a relapse, but it's hard. People will want to give them to me, and I'll be like, no, just keep them away from me. So I just need to stay strong and stay away from them, because I mean, I've learned through relapse after relapse that it's just a vicious cycle. When you go on, you're high and you feel good, and then you have to go through a down period where you have to come off, and it's just, there's more shittiness than good feelingness. So my conclusion is to just stay away from them completely.
And how would, I feel like a lot of people like psychologically become dependent on being that size, but you seem like one of the most like normal, and you're still big, let's put that out there, but like how's your mentality changed? I mean, did you already conquer that hill? That's kind of what I feel,
Oh yeah, well, first of all, I never stopped training, I never stopped working out. I love working out. I'll do it to the day I die. But from that time at the nephrologist's office, and I decided I wanted to heal myself, I put myself in the state of mind of, okay, I'm gonna come off all of the steroids, and I'm gonna lose size. I'm gonna get smaller, and I mentally prepared myself for that. And I'm not gonna say it was easy. It was hard. I remember being on the Smith machine, when my bicep was 21 inches and it would stretch the sleeve, and I remember being at the gym one point, a couple months later, where there was like space between because my arms were getting smaller. So I mean, there's certain things I remember, like watching yourself shrink, is a little discouraging. But I mentally prepared myself for it, and I wanted to do, just like I wanted to do whatever it took to become a pro bodybuilder, I wanted to do whatever it took to get myself better. So I just kind of rolled with the punches,
Awesome. Is there anything else you want like out there?
Well, I think when I first stopped and I was losing a lot of size and I would not see people for a while, I didn't like it when people pitied me, when people would come up and they haven't seen me in a while and they would be like, oh, hey, Mike, I don't know, for whatever reason, that kind of pissed me off a little bit, It's like, hey, I'm still the same person, I'm fine, I'm just like 60 pounds smaller. But I understand that, when people see Mike Morris and they see a 265-pound guy and now they see a 195-pound guy, it's not what they're used to seeing. But, I am who I am, So.
That's great. All right, Mike, I mean, that's pretty much everything I got for you today. Is there anything else you want like people to know? Is there any stories? You got anything like?
Yeah, just the painkillers. Stay away from the painkillers, man. Like I said, if there's one thing I could tell an aspiring bodybuilder, it's, there's bodybuilding drugs you take that help your career, and there's other ones that hinder it, and painkillers is definitely one of those ones that doesn't help it at all. So.
Awesome. And then wait, let's do a little bit about dosages too. Because people love dosages and they want to hear numbers, and you can say them, whatever, I don't care.
Right.
Whatever you say, people are like, oh shit. So what would you say dosages when you did T-Nats, for example, which is, I know, 20 years ago.
Yeah, T-Nat, I think I was taking, I took Deca for earlier in the cycle, and then I think before the show was Winstrol and Anavar. That was it, Winstrol and Anavar, not much. I mean, when you're getting ready for a show, you don't want to take too many drugs. All drugs make you hold water to a certain degree. So, I mean, I think I was taking a little bit of Winstrol and a little bit of Anavar. That was it for the teen nationals. Now, as far as the shows, as I progressed, as I got to be a pro, especially living in California, there'd be a time where I was taking a 3cc shot pretty much every day. You know, I'd take a 3C shot here, 3cc shot here, one on my shoulder, 4 days later, one here, and then I'd take a day off and I'd start to process over. And that usually equates to about 3,600 milligrams a week, basically. And then orals on top of that, not counting growth, not counting insulin, not counting anti-estrogens, not counting clenbuterol. So, you know, there's some doses.